So it seems like two things. Your imaging was all fine. There's nothing wrong with your imaging. You had like a little disc bulge, like L4, L5 area, but it wasn't compressing any nerves. Like most people you do a scan on, you're going to find disc bulges, normal population. So some studies show like up to 80% of the population they randomly screen will have some type of mild disc bulge. But the key thing is if it's actually putting pressure on the nerve and causing radiculopathy, which they didn't report on your MRI. If you had that, they would have clearly put, L5 radiculopathy, canal narrow spacing, you know,
Yeah.
into that. So little disc bulge just means, your disc is just protruding a little bit, but it's not putting pressure in any kind of structures. It's not uncommon to see that. It's not really a big deal. You had a little bit of like a random lesion on your liver, um, which is kind of not really significant. So let me actually go through your imaging first. I know you wanted to go over that as well.
I had a CT scan done in 2016, almost exactly 8 years before to the day, and there was another lesion in a different part of my liver at that time.
Yeah.
So can they reappear and disappear?
Yeah.
Okay.
You just have like little inflammatory reactions here and there. And this is what like so some people are not for full scan MRIs because they go, it just freaks everyone out, and you find these little like trivial things, and people want to investigate deeper, and maybe it's not.
Yeah.
Um, if anything, if you had an imaging study before and you have one now, and it's not really any big change. I personally think it's a good idea to do a full body MRI like every 3 to 5 years,
Got
uh,
it.
just to kind of see if anything's there as a general screen. But you know, you don't have any symptoms or any lab markers of any kind of liver pathology or liver disease, or things like hepatitis or fatty liver on your blood work. Um,
I did have the positive hepatocyte antibodies from
oh,
Cyrex.
okay, that could make some sense. You may have some inflammation there that changes spots here and there, but it's not like you have full-blown autoimmune hepatitis. Like with autoimmune hepatitis, your lab markers would be much worse. I can show you when we go over your blood test. Okay.
Okay.
So here, basically, they went through and did the imaging, the neurological imaging. Everything was pretty much normal with your brain. Didn't find any kind of lesions, which was good because there was a possibility you may add some demyelination or like some MS patterns that may be causing some weakness, and they would have identified like what are called hyperintensities or scarring throughout the
Okay.
imaging report. So that was one of the main reasons that we wanted you to do this because you had some like weird neurological symptoms for some time now, and it's like with your history, do you have any demyelination or inflammation in your spinal cord or in your nerve, and do you have any kind of compressions anywhere? So
Yeah.
basically ruled all of that out. Um, mild to moderate degenerative change in the lumbar spine, that's just, going to happen with people just as they age. But
Yeah.
it's nothing that would indicate any kind of cause of muscle weakness or neurological symptoms.
Is
And
there anything I can do with my diet to support the tissues there going forward? Because I have had I have thrown my back out where I'm almost incapacitated entirely for a week to 2 weeks. And that wasn't too long ago.
for degenerative changes of the spine and even like a mild disc bulge, there's not all you can really do is keep your inflammation down. There's some like trivial things like people take glucosaminosulfate or things like that for the disc, but it's not like a game changer or that's just it's for an acute disc herniation that's like torn and you want to heal it. Um, that might be supportive, but ultimately you want to actually move as much as possible and bring your inflammation down. Uh,
Move, you said.
Motion, movement
Yeah.
helps get blood flow to your disc, to your cartilage, to your tissues. That's the key thing.
What's the
Sedentary
thing you
lifestyle.
said? Glucosamine what?
Sedentary. I was just saying sedentary lifestyle with
No,
inflammation.
before that, the
Oh
glucose, you said glucosamine,
yeah, glucosamine sulfate.
glucosamine sulfate
Yeah,
for future.
it's not a game changer. Like if you're already taking a lot of supplements, how many more should we worry about?
Making as few as possible, which is nice.
I think the anti-inflammatory strategies you're just doing on a regular basis would be the most protective for that, anyways. And
Yes.
quite honest, it's not very bad. So this liver here, this little hyperintense lesion, you said you had this before in a CT in a different area, but like a one little centimeter hyperintense lesion, it's hard to say if it's related to anything. If you had the hepatocyte antibody, maybe it is a like a subtle autoimmune reaction, inflammatory reaction there, but you don't have the concern here of having autoimmune hepatitis. Like the liver is one of these tissues, if you have two-thirds of it destroyed, you're still functioning. I mean, you're like a little white lesion in that area. It's not nothing.
Yeah.
And
The
this
other one was a low intensity lesion, so I
yeah,
don't know what the difference.
hyperintensation. Yeah. This one here. Oh, the other one. Oh, it's just the type of imaging they're doing. Like a CT scan is different than a T1 or T2 MRI scan. But it's
Oh, maybe. Okay.
yeah. So here we're looking at all the different glands and everything. Everything seems to be fine. You had a little bit of a nodule on your thyroid gland.
It's
Like
exactly the same size as when I last measured it, which is awesome. I don't
and
want to grow.
statistics are like so if you're 40 years old, there's a 40% chance you'll have a thyroid nodule. If you're 50 years old, there's a 50% chance you have a nodule. If you're 60 years old, there's 60%. So you're going to get a nodule at some point, statistically. So the size isn't big enough for concern. It's not really a big deal. So as far as your anatomy goes, you have no demyelination or any expressions of autoimmunity injuring your nervous system. Doesn't seem like you have any reason from like a neuropathy, like a disc herniation or any kind of nerve entrapment causing any of your muscle weaknesses or leg weaknesses as far as anatomy goes, like hardcore compression or injury to that.
Yeah.
And that was really the main purpose of getting that done. And then it just kind of up to you. Just go over the blood test here. Because this is the most recent one. So your TSH is on the lower end. That's because you've been increasing your dose, but it seems like increasing your dose has made a huge impact on your function, right? Your muscle function, your muscle endurance, your energy.
This is the biggest change in my energy level since the beginning.
Perfect. Okay.
Yeah.
So
Wildly different.
most of
Yeah.
the papers published nowadays on thyroid really show like you can't just count on the lab range. You have to look at symptoms and how you're functioning. So the only concern you would have is if you're taking too much thyroid hormones, you would have trembling, nervousness, anxiety. You wrote on the follow-up here, like you have some issues with sleep. That may be something early. It's hard to say, but it's just something to be aware of. It's better for you to keep your muscle under if you're not getting any symptoms of being hyperactive and your metabolic rate being really crazy that's bothering you. If your function is coming back, then that's perfect.
The sleep has even, since I wrote this update, completely gone back to normal in the last week on
Okay.
its own.
So it sounds like your body's responding to the dose you're taking, and
Yeah.
that's perfect. Then as far
Wow.
as like the rest of your thyroid panel goes, like looking at conversion issue problems of converting T4 to T3 or any kind of like binding globulin imbalances or other things that can take place with your thyroid, you don't have any of them. It's all fine.
Yeah.
Yep. And then so your thyroid is there, pretty good there. Then your iron bite, this is just your iron markers. Everything here is fine. There's nothing wrong with iron deficiencies or any type of iron anemia. This white blood cell being low is still important. So this is one of the things you always want to track from this point on for the rest of your life. You
Okay.
always want to, make sure you have a CBC, the white blood cell count. And, you know, give it a little bit of time with what you're doing with your thyroid hormones and like healthy sleep and see if those go up. But when you see like a chronically low white blood cell, sometimes it could just be from the autoimmunity, just keeping it low. But then at
Mhm.
that point, if you can, fine tune your diet, nutrition, lifestyle to modulate the expression of your autoimmunity, it starts to go up. And, or, I mean, you just don't have a pattern for active infection. Remember, we looked at the T and B cell panels and those types of things. I don't think you have a hidden pathogen. I don't think that you have a chronically hidden parasite. That seems to be ruled out at that point. And a lot of the parasite meds you're taking are very immune suppressive. Maybe they're still in your system having an effect, and maybe need more time to clear them out. It's hard to say right now. Um, you could consider like nutritional strategies more aggressively to raise your white blood cells, or you can just give it time. But your white blood cell count is something you definitely want to look at. And I can tell you, working with a lot of autoimmune disease patients, this is a big indicator of going into remission and recovery completely. But
Wow.
that's, yeah. Like I remember when there's a period of time I just saw a group of really, really wealthy patients, and they all knew each other, and they had a practice close to here area called Rancho Santa Fe, which is a very wealthy area. And all of a sudden, I just got this whole crowd of them coming in, all of them with, oh, this functional medicine thing's cool. Can we test everything? I'm like, yeah. And it was everything. So we were like testing everything, and it's actually quite exhaustive to give everyone every test like for a while.
And then I have to explain it all.
Obviously a lot of the patients had autoimmunity, and then we were looking at different markers, and the white blood cell count was the the one that was most clinically significant on a CBC, which is like $10 to run. You know?
That,
So,
that's awesome. So nutritionally, what makes a difference with that?
so that's the thing is, if
Or
you might want to experiment with things you have not tried. So if you like look at botanical stimulating nutrients, you have a whole list of them, right? Anywhere from like echinacea to astragalus to um, vitamin C, vitamin A, or you can go more exotic and try different things. But I don't think with like your underlying autoimmune type pattern potentials here that you have like a flare up with one immune stimulating herb or another. You don't have a history of that, right?
I have no flare-ups with anything
So,
except maybe chemicals and mold.
yeah, and maybe well, let's talk about this more. But this is an indication here. Like you could have like ongoing chemical challenge, depletion of antioxidants, making your white blood
Uh,
cells low. So we'll think of that as a strategy as too. Mold, mycotoxin exposure. I mean, do you feel noticeably better being in your home now than when you were back home, back in Europe?
well, we don't live in the moldy house anymore, but it was
Was
drastically different when we left the moldy house.
But what about now, just being in a different environment?
I don't, I feel better here than I do back in Europe right now,
Well,
but there's a lot of lifestyle factors that are different here for me.
I mean, one thing that I think we were just talking about yesterday is it's interesting. It may not be connected, but it's our digestion, like metabolism wise, like both of us actually notice a difference, like in terms of the way we process food here in the US versus in
I
Europe.
don't know why.
It's like instantly back here, like we're both like, wow, I
Different.
don't get as I'm not as belchy. I'm not like because I kind of can have like a gurgly stomach, but Mary's like digestion's like much
But I
better
hope it
here.
could be the thyroid medicine.
Well, maybe, yeah, that's true.
It's
But
hard to say. Yeah.
one
Well,
other so
you have to
can
just be aware of like you have to kind of be your own detective and try to figure out some things. At the end of the day, like I would tell you, what any clinician would do is they'd go, okay, here's what's your baseline marker we want to try to compare with and see if things are changing. Like for sure, you can always do the white blood cell count, right? And there's lots of even I'm not sure where you're going to be in Europe or you're going to be in the US, but in the US at least, there's different companies and most states you can go and order your own labs or
Yeah.
especially you can order your own labs. You can always check your white blood cell count. If you can get it close to 4, like above 3.5, that would be nice.
Uh,
on the just Dr. Krasian, on the white blood count, did you say that the thyroid medication would also have an influence on that?
it
So
could.
like it could help increase if her thyroid gets
Yep.
better treated or whatever.
Yep. There's lots of evidence. White blood, thyroid hormones directly impact the metabolic rate of all immune cells.
Okay.
It can really
This
impact.
was before the NP thyroid meds, so this will be a
Even
good
all the time. It's,
line.
it's possible, like you know, thyroid hormones after 60 days, something like that, really start to impact your new white blood cells, and their metabolic rate's more active. Your immune system gets healthier. It's really a significant impact on white blood cells and all immune cells, of course. Okay, so that's the only thing that was there that was important. Glucose here, just slightly the range of 70 to 99 or 100. That's not really a big deal. You don't have any big concern with that. Now you did switch off keto, right? You started to add in some foods. We talked about that last time to see how you feel.
Yeah.
How'd you do with that? I know you put some things in here. You're taking like berries or some things like that.
I think I get bloated really easy with carbs, like really easy. And I did notice that with the rice seems to be okay. It does seem to alleviate the moodiness and irritability after working out. So that's good. I was gonna ask if the bloating is an issue, is there a type of carb that is better for my gut? Then I don't know if it's SIBO or whatever that's causing the
Yeah, it's
bloat.
possible. Like I know you had that past pattern with like SIBO being an issue for you, right?
Yeah, it was positive before, and I just kind of assumed if I have bad motility, low thyroid, that it might always be kind of plaguing me. I don't know what your thoughts are on all that.
Well, at some point you still want to experiment and see what you can do, what you can't do. A lot of times, if you haven't had much carbs and you start eating carbs again, you have to have your digestive system get used to making enzymes again. You
Well,
know,
I'm taking a bunch of HCl and Enzymatica, Digest Gold and lipase.
yeah. So you might need to just take some pancreatic enzymes then. Because hydrochloric acid is going to digest protein, and the lipogold is going to digest fats. But if you take pancreatic enzymes, they have a greater effect on carbs, like starches and fibers.
Okay.
So you can like try some pancreatic enzymes. You can play with the dosage, see if that helps you with your bloating. You can also increase your dose of hydrochloric acid because hydrochloric acid will trigger your pancreas to release pancreatic enzymes.
Okay.
Um, but do you feel better overall with being in keto or not really? Some things are better, some things are worse, or because you said your moodiness and things can change when you're eating some carbs in a good
If
way?
you stabilize that, I'm not eating a ton of carbs. I just ate some rice before working out. And overall, I wouldn't say it changes my energy levels. The thyroid hormone was
Big.
drastic. The food is not so much, but the working out, I do feel stronger and I don't feel so depleted. And yeah, it stabilizes me through the workout.
Okay. So you might find your balance of what amount of carbs you want to take. Maybe, you have to look at your brain function and your brain endurance
Yeah.
with that and figure out what works. You don't have to be on keto forever. We're just trying to dampen your neuroinflammation and really going after this from a head injury perspective and seeing
Yeah.
what you can do. But I would say you're gonna be sensitive to blood sugar spikes. Like you gotta still be careful.
What do you the insulin? I've heard someone say, or several people say 2 to 4 or 5 on the insulin, and that mine was higher, and I was really surprised about that. Mine was 6.8. And one of the doctors I saw said, "Do you get hungry and thirsty a lot?" And I thought, sometimes I'm constantly hungry and thirsty, and they were wondering about that.
I wouldn't consider this high. I don't know why they would say that too. This is your fasting insulin, right?
It is,
Yeah.
yeah. With mostly keto, I don't think I would have come off of.
I mean, if you really wanted to investigate this more, you would just do an oral glucose tolerance test where you would take a predetermined glucose load and they'd measure blood before that, an hour later, 2 hour later, and then they would see if you spike and up and down and map it out. But that's not a fun test to do either. Yeah. Have you ever done that test before?
No.
You drink a solution that's Gatorade on steroids. It is so
Oh,
like even hummingbird might not drink it. It's so sweet.
oh God.
And then basically you're gonna like feel this glucose load in your system, and then they keep you do 3 blood tests in that same day, but you will probably find any kind of abnormalities when you do a challenge like that. But I don't think it's that big of a deal. I just see it from your history. Like you seem like people that really function better with keto um, tend to tend to be sensitive to glucose spikes. But you
Ah,
if you eat too much carbs or glucose, you're going to get some more brain fog. You're going to get some like fatigue. You're going to get some crashes. As long as you can like pinpoint
recognize that.
those that work for you, that would be ideal.
Okay. I was gonna ask a question about SIBO. Would you,
If you're getting bloated and distended all the time, and the enzymes aren't helping you, you should really consider switching whatever. Like you might not be able to handle rice and starches. Maybe
okay.
like just meats and fruits and some fats, you know, but you don't want constant bloating and distension. That's definitely going to be a sign you're going to create ongoing inflammation.
The thing was like I had maybe I didn't realize how much some kind of natural sugars or whatever were in something that I had, and it like threw me off for maybe a week or 2 weeks, to the point where FODMAPs were an issue again, and I had to cut back on avocados and
Yeah.
like kind of whiplash.
Yeah. The thing is ultimately you will know what's working for you now. Like you understand the concepts and principles. It's not like like a theoretical based diet. Like you're basically looking for sustained energy. You don't want to crash. You don't want to get fatigue after meals.
I don't
Uh,
want to be bloated.
yeah, you don't want to be bloated.
So is it SIBO? Is that something that if
Seem
you
to
said,
have like my initial impression when I worked up your case was like you had a brain gut access disorder from all your head injuries, and you were leaning towards the SIBO pattern, and you would do better with like a SIBO or ketogenic diet. And I think that still holds true, but as you're getting healthier and functioning better, especially with your thyroid hormone replacement, it's time to kind of see what your limits are, so you're not so
yeah,
restrictive. You can diversify your gut and see how, see
To
what,
keep playing with it, and that it may be an issue ongoing due to the head injuries.
yeah. And if you get like
Yeah.
bloated and like constipated and you have like like you're just not functioning well, you probably should just go back to like a pure keto and recover. And
Okay, and not be chasing it with supplements and medicines and things that people want to throw.
well, just get in ketosis.
Got it.
Yeah.
Check. Okay.
All right, so let's go through it. So lake muscle.
Was there just sorry, Dr. Krasnian, but on the notes with the labs, the calcium, was
Oh,
there any thoughts on that? I know that was noted as high as well. I mean, I don't, is that something you wanted to talk about or?
We can, if he has an opinion on it,
yeah, let's make sure we cover everything. Maybe I missed it here. Oh, this calcium, that's just vitamin D.
No, it was sorry, it was up a page, one more page, I think, just
the
the,
just plain old calcium.
yeah, calcium was noted as, I don't know if that's,
Oh, this is 0.98. This is from your thyroid hormone spurge.
oh, okay, okay.
I wouldn't worry about that. This should normalize. Like when you do the next test, like these will sometimes spike up and down as you're increasing dosage of thyroid hormones.
That was before.
10.9 is now. No?
Okay,
And that's a big deal. Okay.
that was it.
And then, yeah, where are we? What next?
Okay. So let's go back to, was there anything else in the labs?
I
No,
don't
that
think
was the
so.
question I had. Thanks.
Sure. Okay. So let's go over here. Oh, energy evening still uploading. Yeah. End of day energy is still low. It's reasonable to expect to have good energy in the evenings. So one of the key things you have to remember is like you don't just have a thyroid issue, you also have, you do have clear indications of brain injury you've had throughout your life. And you just may have some endurance issues. Your fatigue is most likely brain-based fatigue. So you got to figure out how much stimulation you can handle per day, how much rest you need. Do you need to take a nap? But I wouldn't don't expect everything to be like thyroid. Some of it
Okay.
will just be endurance of your brain.
Yeah, it's tough to keep all these different factors in mind. I
And
see what you're, it's a lot.
leg muscle still after exercise. So I think as you can, well, this should continue to improve. Like if your thyroid hormone dosage is normal, as you continue to be physical and work out, you're gonna just keep building more and more mitochondria. You obviously don't have any demyelination or injury to your cord or nervous system that's causing your leg muscle weakness. So it's most likely just metabolic.
Mhm.
So I think you're unwinding your metabolic patterns as you're getting your thyroid hormone dosage normalized.
So there was one note above, but it pertains to the thyroid. So since switching to the NP thyroid, my heart rate is continuing to decrease.
Yeah, I saw
She's
that.
gonna have me bump it up by 15 milligrams.
It's not,
Um,
it's not normal. And to be honest with you, I'm not sure why that's happening.
okay.
Typically, people's heart rates go up when they start taking more. Maybe it's having an autonomic effect on you, but
The equivalent dosage was going down in T3, at least. It's equivalent to 25 micrograms, and I was on 40.
yeah.
So she's gonna bump it up, I think, but
Say anything
that,
about, does she experience that before? Is that something?
she didn't say.
Yeah. Yeah, it's not a common thing. I haven't seen that like hers.
No.
Okay, let's see. What do you hope to accomplish? Okay, so review scan results. Okay. Yeah, we went over the scan. No signs of demyelination. There's no real indications of like traumatic brain injury lesions on your MRIs. I
Can
mean,
you tell the difference between you can tell the difference between a TBI and like the ganglioside lesions?
so first of all, like you're never going to see any change on MRI from brain injury
Okay.
unless like there's blood swelling and compression of the brain from artery being ruptured or injured. Okay. Because a lot of the fibers just shear brain injury. They're not like destroyed. They don't cause enough change to cause a signal.
Okay.
One thing you will see autoimmune markers like ganglioside and stuff, and they'll just be what are called hyperintensities of white matter lesions. You don't have any of those.
That's great, but I don't.
Frequency to get these scans, yeah, so like every 3 to 5 years. Um, Ways to support mitochondria for leg strength. So a lot of this may not just be your legs, it could just be your frontal lobe, your brain too. So if you look at I'll show you. Like when you say your legs are fatiguing, it may not be your actual leg muscles itself. It just may be the pathways from your brain to your legs, like your frontal lobe motor pathways. Because if you look here, you do have a lot of like when you look at your injuries and like you do have a lot of frontal lobe symptoms.
Mhm.
And the frontal lobe here is like your executive function. But if you just go a little bit to the side, that's what controls your arms and legs. It's the premotor
Okay.
strip. So a lot of times, like you see here, like supplemental motor area, like reduced muscle endurance in arms and legs. When you're always getting tired at the end of the day, again, it may be related to your brain fatigue, not so much your leg itself.
That makes sense. That makes sense.
Yeah. And especially if you're seeing the leg fatigue correlate with your brain fatigue. Like your focused attention concentration is not as good. If your focused attention concentration are like buzzing and you're great and your legs getting tired, that might be more like a leg muscle issue. But if your brain is tired and you can't focus, concentrate, and take in information as well, and that's when your leg's tired, it's probably your brain, not necessarily your leg.
I'll keep an eye on that.
Still the same
And
thing. It's still mitochondria to these areas of the brain, you know.
hmm,
But it's that pathway more than likely. It's that premotor strip.
I noticed that it changes a lot with the thyroid medicine. I've gotten, my legs are a lot stronger, a
Yeah.
lot. My whole body doesn't feel nearly as heavy.
Well, thyroid hormones for sure will
Rest.
impact your brain mitochondria and your neurotransmitter activities in the brain, as well
Uh,
as well as your local muscle mitochondria. Because remember, thyroid hormone receptors are found in all the cells in the body, and they control the metabolic rate of cells. So it literally has an impact on everything.
it's well worth the trip here just for that medicine. Wow.
Yeah.
A question just on the exercises, Dr. Krasny, just a reminder for myself more, maybe Mary, but like the brain exercises that you have Mary doing with her hands, the motor skills, is the objective there to will some of that over time help to kind of improve the brain's endurance to where some of that is, I'm just trying to remember if that was.
Activating
So
that.
like the model of brain rehabilitation is you have an area that's injured and you want to activate that specific area with tasks related to the area of brain that's injured. And as you do activities, a couple things will happen. One is that it does turn on the message to make mitochondria around that area. So those neurons there will start to have demands and they'll start to turn on messengers to make more mitochondria. So over time, that should help with endurance, right? And then secondly, you activate nerve branching. So you have, an injured neuron and a healthy neuron. The healthy neuron can branch over the injured neuron. So that's the whole model of rehabilitation as you activate the area. So like if you have leg weakness, any kind of complex leg movements, motor activity with your legs, just exercising your legs are still going to activate the area of the brain. And if you were really thyroid hormone deficient, doing those exercises may not have been as impactful now that you're getting thyroid hormones to your normal demands met. Um, you might get a lot more out of things you tried in the past, but wasn't working as effectively.
Okay.
Okay.
So the Arizona doc, yeah, the HRT, she looked at my levels of all of those hormones and said it was her thought that it's not that I have good enough levels for brain
She wants
health.
to put you on replacement.
She does not want to.
She doesn't want to. Okay. Um,
Do you think that that's
the thing with hormones is it's if you go to 5 different hormone specialists, you're gonna get 5 different answers.
yeah.
If there's any part of medicine that's like the Wild West, like nothing, it's HRT.
I think I've heard someone else say that as well.
Yeah, I mean conventional model, like you just go on estrogen progesterone combination at a certain age because insurance companies cover that. Provera, Prometheus, Provera, and then can't remember. Anyways, the typical synthetic dosage that you would go on, and outside of that, if you go to anyone else who's an expert and they kind of do their own levels, they check and they have their people they work with, it's all over the place. So you could talk to a different person if you feel like you want to head in that direction and see what they say. Typically, the chances are the more the practitioner has specialists in hormones, the more likely you'll be on it. So if you go
Yeah.
to someone who's like, you go to an HRT clinic, like that's all they specialize, the chance of you leaving without being on hormones is very low.
Yeah.
And it's something you can experiment with because the problem with hormones is just like you're experiencing now. The levels that you have are just a reflection of a number compared to a population, but it doesn't really explain what's happening to the receptor site. It's not really a reference to how things are being cleared. It's not really reflecting how the receptor sites are responding to lots of variables beyond the hormones that activate the receptor sites. So, you have to decide if you would like to push that angle more, but it's another thing that would be trial and error. You could take it and notice another big boost in how you're feeling, just like thyroid hormones. It may help your brain recovery. Certainly, hormones do help with brain recovery. And I would say it's something you may want to consider looking into as you're trying to find everything to kind of improve your brain recovery and trying to improve your white blood cells. But
Oh,
anytime you take some hormones, there are some risks for proliferative conditions. I don't know if you have any risk in your family, but the risks are still pretty low. But all things you take have some risk. So something to really think about here.
okay. Really good. Okay. I gotcha.
All right. And then the problem with your hormone levels too, by the way, this is are you postmenopause? Where are you with your hormones right now? Are you
I
postmenopause?
think I must be in perimenopause because my period is getting really light and
So in perimenopause, your hormone levels are completely unreliable.
okay.
Because you're losing your pituitary brain feedback loop and your levels all over the place. And if you look at these ranges, like they're so far apart. So you're
Yeah.
not clearly in like follicular, luteal, or and ovulation phase in perimenopause, and you're not clearly in postmenopause, right? So there isn't really a perimenopause range, and there really can't be because it'd be so broad because you can be all over the place. So some people that are in perimenopause just go on replacement to see if it helps them with their symptoms and functions and just make sure the levels aren't like extremely high and they're overdosing.
Okay.
That will really depend upon the person you seek. If you go to HRT therapy clinic, it's very high likely they'll put you on replacement.
Mm, good. Yeah, good. Maybe that's obvious to some people, but yeah, that's okay. So
But
that
I
and
would I
then
would I would definitely consider it if I were you because you could get another big boost or if it doesn't work for you, just stop. If you don't notice any difference in anything,
exactly worth trying.
yeah.
That's a good way to put it.
Okay. Is insulin resistance hypoglycemia all related to inadequate thyroid hormones? I mean, no. I mean, thyroid hormones have an impact on blood sugar stability, but it's not all related. I'm not sure if I answered your question right.
Yeah, I was just looking for the best way to control that.
Well, you're gonna have to experiment, like you're saying, with your like the amount of ketosis you're in, the amount of carbs you can handle. Like, there's no way around it but experimenting.
It's just through diet, the
Yeah.
hypoglycemia stuff. It like there's no other way
Well, the
to.
other thing will be frequency of what you eat. Like
Mhm.
how frequency you eat. There's some indications your blood sugar is low throughout the day, but
What? Yeah.
your glucose was high, but your HbA1c was the average of 6 to 8 weeks is on the lower end. Your glucose was like zero point 0.1 high, not like seriously like really big concern here. Let me see where it is.
Yeah, it was like 4.7 or
Hey,
something.
remember that? You saw that? Yeah, here it is.
Oh yeah.
Before is 4.5. So some of that could be because you're in ketosis all the time, but
And fasting.
and that would be for you would just be eating frequently enough, more so than
And if that helps, then my HbA1c should go up a little.
yeah, yeah.
Okay.
Okay, let's get through here.
Insulin,
Okay, any cool things available in arenas of autoimmunity and brain health? You mean
really?
like,
So if we're going in order, could you skip a couple at the top, the
or
top of that? What is your best parting advice for my case going forward?
where are we?
Top
Oh,
bullet
here.
on page, what
Right
page
here.
is it?
What is your best advice, thoughts for my case going forward? Okay. I would say experiment with your diet, listen to your body. Your thyroid hormone's a big deal. Definitely understand you have brain endurance issues, brain fatigue. Okay. Um, you could look into other types of like biohacking therapies, which would seem to get more and more evidence as time goes on, like saunas, cold plunges. Those things can definitely help with recovery. They help support mitochondrial biogenesis. Um, Heat shock proteins help when you get in like saunas and get a lot of heat. They help clear out debris after injuries, even in the brain.
Wow.
Cold plunges release cold shock proteins. They help with growth factors and things like BDNF and dopamine that help with recovery. So you could start looking at some biohacking things unrelated to just supplements. You can look at red light therapy. Red light therapy is also shown to be very effective in improving mitochondria. You know, it just depends on like what's doable for you, and like can you get some of these equipments and put them in. Of the most important things for brain injury recovery, it's going to be like photomodulation, which is going to be like red light therapy, or
Right.
an actual laser for the brain. Like they have these
Okay.
little cranial lasers, like you put on your like a helmet. They're
Okay.
they're quite expensive, but
Is
they're
that
good.
is it like a bee light? Is that what that is?
No, it's like a low level laser with the
Do you
red.
have like a name of the device or something that?
Oh, well, if you Google, you'll see a lot of different manufacturers. It's just low level laser, cold laser.
Low level laser,
Yeah, cold laser, low level.
cold laser. Okay.
And then
Yeah.
basically they have some like with little helmets, and you might want to go to like a center where they do these things first and see if it has any impact before you think about purchasing, right? Like a red light therapy machine is just like basically a red lights, and you just have your skin exposed to that. That'll help
I
with
just
mitochondrial function.
need
Those are
someone
those are like
there.
$2,000 for like a nice big one.
Mhm.
If you type in red light therapy, you'll see different manufacturers. And then
Is there
obviously sauna, you know,
specific nanometer for the light, or is it
the ones that do this that supply them are all using the wavelength frequency for the mitochondrial effect.
okay?
Yeah. And then cold plunge is pretty easy. There's different versions. You can make your own. You can buy them. There's some that are like in
It's
plastic
been on our
barrels.
list for a long time, those two things, and there's two really big sauna makers here in our state.
Oh,
We're gonna do a trip to look at them and possibly
you should
purchase.
really look into those. Yeah. I mean, they're good. They're very good.
Okay.
Um,
Good.
those
And
are like,
then
so those would be three things that could really help you with your recovery, that outside of more just the functional medicine perspective. Um,
both interested in that, yeah. And then our protocol going forward, any modifications or changes to that?
um, the key thing with you is going to be making sure you don't fatigue your brain all the time and you kind of understand your endurance levels. Like if you get in the end of the day and you're totally exhausted, your brain's fatigued, you don't really want to push yourself with a lot of activities. That could be a good time to go into a cold plunge. That could be a good time to go in a sauna. That could be a go.
Okay.
It's
What's the when it's fatigue, what's the thing I'm avoiding with that?
uh cognitive tasks for you specifically.
Is it further inflammation that needs to be avoided, or that
There's a
was too much
there's a point
information?
that is a point if you're trying to recover, if you keep pushing it past your metabolic level of tolerance, you just exhausted, it's hard to recover. It's just like if you're trying to build muscle,
Got it.
if
Okay.
you overtrain all the time, you can't build muscle. Like you have to take time off to let it repair and recover. It's the same concept. Or if you're a runner, like you have to run, you have to stop sometimes running and let your body recover. So with brain injuries, if you constantly get into fatigue and exhaustion and not let your system rest, it's hard to recover.
That's the challenge going forward.
Okay. Motor plane exercises and any cognitive tasks you can do, any kind of motor coordination, especially with areas where you feel like it's weak, like your legs. Anything you can do, like do alphabets, do movements, try to draw with put a pen in between your toes and try to draw something. I don't know. Anything you can do, you can
Oh,
be
yeah.
creative with, that would be ideal to get that motor system. If it's both your legs and both your legs, if it's your arms, you want to use your arms.
Going fish oil at 10 grams going forward, is it a long-term thing?
I don't think there's any problem with that.
You what?
I
Okay,
yeah. Yeah, that's probably good. More and more research is showing you need much, much, much higher doses. Even 10-gram dosages seem to be pretty good, pretty adequate. Yeah.
great.
Okay, calcium. Let's see. As far as your minerals go, basic nutrients, I don't think it's going to be a game changer for you. You should just,
Okay.
take whatever you think your body needs. Any cool new things? Okay, so we did that. Featured 3x, array 3.
It's the celiac.
Oh, how to eat.
I put a screenshot at the bottom and I was just curious if I go ahead and do that with what things would indicate if I do have some celiac. Is it just the transglutaminase?
Let me pull up your file here. Let's see, your array 3.
Oh, I didn't do it.
Oh, you didn't do it.
No, I'm saying in the future, if I can get it ordered at some point.
It's just going to show you if you have. It's going to if it's celiac, you're going to have like the transglutaminase enzymes up.
So there's only the three, and one of those must be positive. And if anything else is positive, it's just a non-celiac wheat sensitivity or non.
Gluten sensitivity, yeah. And technically, you'd have to have like the gene type if you want to know if you actually have celiac. You know, is it important for you to know if you have celiac or not?
It's secondarily important.
Okay.
It will help. It can helps me make a decision if because my symptoms are so subtle.
You can go to a lab called Interolab.
Oh, I
E
know. I talked to him
Do
before.
Interolab, do the cheek swab for the DNA screen.
Okay.
That's your first distinguishing marker to see if you actually have celiac and see if the lab comes back with celiac genes. And I'll tell you on the report, HLA-DQ2 or HLA-DQ8.
Okay.
Now, you might just have gluten sensitivity genes and not actual celiac. And all celiac means is your T cells are very aggressive attacking gluten, but you can still have severe inflammatory reactions with gluten and not have celiac.
Understand. Oh, got it.
Okay.
And then is array 4 meaningful mainly if you're celiac? Like, should I identify that first and then do array 4? Do you see what I mean?
I don't think so. I think as long as you have the antibody, you should avoid it. But if you haven't been eating gluten for a long time, like 2 months or more, you may have a lot of false negatives.
That's true. So then to eat for that, how long do you have to have some kind of exposure to do
So
that?
antibodies will start to go up. The labs can change the lab range within 2 weeks, but they can peak around 2 weeks to 2 months is where 2 months is where they start to peak. But they'll start to go up in 2 weeks. Like if you had it on Monday and do the test on Wednesday, it may not catch it.
But like with some frequency, as long as I'm not having symptoms to expose myself to
Yeah.
stuff,
I don't know if it's even worth it. I mean, you should just
you know,
it should just be gluten free with you. There's no
I'm
way.
not planning to eat it. So what I'm planning on understanding is if I need to go to extreme lengths to
Oh,
avoid cross
then I
contamination.
would just say do the gene test. The gene
Yeah.
test, because the gene test is going to tell you have the gene type where your T cells are so
Like
aggressively reacting that you have to be so cautious.
if I ever have French fries, if they use the fryer for one thing, but the fries are technically gluten free, but cross, you know what I mean? That kind
Yeah,
of level changes
yeah,
your whole.
you should do that anyways.
Ah,
Yeah.
no.
Okay.
Okay.
Do what?
He's saying avoid cross contamination.
Oh yeah.
Yeah.
Yeah, yeah. Yeah,
Really?
for sure. 100%. You don't
Okay.
have to have celiac for that. Yeah. Celiac is like the person's got to carry their own food. They could probably never go out.
Yeah.
It's a whole different story. But gluten sensitive, you still don't want to. You still want to avoid cross contamination. Are you eating a lot of French fries?
No.
Okay. Okay.
Had some for the first time in a long time. Not like a just
Yeah, yeah, sure. So here it looks like you do have some hypoglycemia symptoms on this form.
yeah.
So you might have to eat more frequently than you are.
Okay.
Like with these symptoms, your HbA1c being low, you probably need to eat more frequently. Now, whether it's with like high fat, low carb things, or if it's with some, you know, fruit, that's not high in sugar, like an apple. I don't know. You'll have to experiment.
Okay.
Yep, those are the main things.
Mm, okay.
So I would say moving forward, you're on the right track. Thyroid hormones is a big deal for you. You may even want to consider some reproductive hormones. You may want to consider like using some biohacking things like red light, cold laser, um, saunas, cold plunges that can really help with your recovery response.
Mm.
The key marker to look at from your labs moving forward should always be white blood cells. You can
Okay.
experiment with different immune supplements and just see. You haven't tried some different ones. You haven't tried some. You can try some different ones, see how they do. It's also possible you could just need to take a lot of antioxidants. Maybe if you really feel like you had chemical issues or mold really bother you, you may need to just bump up your antioxidants. Antioxidants are going to be like all your different flavonoids. You can experiment with different ones of flavonoids, or you can do a combination of both immune enhancing flavonoids and see if your white blood cells change. That would be a pretty good strategy.
Is there anything with Apex that's easy to purchase? Or are you saying mainly try to get it through food?
No, we would definitely want to use supplements in addition to your healthy diet. The ones from Apex would be like X-Vitamin and XFLM because you got flavonoids from the XFLM and immune enhancing stuff. And X-Vitamin is all really focused on getting natural killer cells and T cells up.
Okay.
Those are two good ones.
XFLM and experiment. Okay. And then I guess is there anything else before we anything else that I'm missing?
I think you had a question about the labs, I think, or something in the future.
Yeah, white blood cells for sure. That's your main one.
Oh, that I can do that offline.
Okay.
Let me stop the recording here.